Welcome to today's Explainer. We're going to pull back the curtain on a massive, yet almost totally invisible public health crisis. You see, right now, Americans over the age of 60 are officially the most medicated population in human history. And look, there's absolutely no denying that modern medicine is a miracle. It's saved countless lives, managed diseases that previous generations just couldn't do anything about. But it's also created this hidden threat. We're facing a literal crisis of over-medication and medication-related harm. And the crazy part? It gets almost zero attention during your standard, rushed 15-minute doctor's appointment. Most older Americans are completely in the dark about it. So today, we're going to break down exactly what happens to your body when you mix multiple prescriptions, and much more importantly, how you can proactively and safely take control of your health.
Okay, let's dive into this. 15. That is the staggering average number of prescription medications that an American between the ages of 65 and 69 takes every single year. And if we look at adults aged 80 and over, that number actually shoots up to 18 or more. I mean, just think about that for a second. We're talking about a daily routine that revolves entirely around this complex, constantly rotating menu of pharmaceuticals.
So this brings us to a medical term you really need to know: polypharmacy. By definition, this is the practice of taking 5 or more prescription medications simultaneously. Right now, as we speak, this affects nearly 40% of all Americans over the age of 65, and about 20% are actually taking 10 or more. Now, while each individual drug might have been prescribed with the best of intentions by your doctor, the root of the threat here is the mix. Combining this many chemicals exponentially multiplies your risk of unseen harm. Section 1. Your body after 60.
To really understand why this overmedication is happening, we have to look at the biology. And the very first thing I want to make crystal clear is this: if you're experiencing strange side effects, it is not your fault. It's simply a matter of human biology. As we age, our organs fundamentally change how they process, respond to, and clear out chemicals. And this brilliantly illustrates exactly what I mean. In a 40-year-old body, your kidneys clear out breakdown products normally, and your liver easily deactivates those medications. But by age 70, your kidney clearance is naturally reduced. Blood flow to the liver drops by about 40%. Plus, older adults just naturally have a higher fat-to-muscle ratio. And because a lot of sedatives and pain meds are actually fat-soluble, they get trapped in that tissue. So a drug that does its job and quickly flushes out of a 40-year-old's body, it ends up lingering and staying active in a 70-year-old system for way, way longer.
Because of those biological shifts, especially that declining kidney function, along with the fact that older receptors in the brain and heart get way more sensitive, researchers point to this terrifying reality. It's effectively producing an overdose effect without any change in the prescribed dose. Just let that sink in. You could be taking the exact amount your doctor wrote on the prescription pad, but your aging kidneys can literally cause the drug concentration in your bloodstream to double or even triple.
Section 2. When medications fight each other.
So, what happens when you introduce 5, 10, or 15 of these amplified medications into the exact same body? Well, they start fighting each other. We see this all the time with high-risk prescriptions like blood thinners, specifically warfarin, which interacts with an absolutely massive number of other drugs and even foods. Or blood pressure medications, which, when you combine them, can cause life-threatening drops in your pressure just from standing up. The sheer math of polypharmacy is just wild. If you take 5 medications, there are 10 possible 2-drug interactions. Okay, maybe manageable. But if you take 10 medications, that jumps to 45 potential interactions. And at 15 medications, which remember is the average for a 65-year-old, there are 105 possible interactions happening inside your body. It is practically impossible for any single primary care doctor to accurately track 105 interactions, not to mention those totally unpredictable 3 or 4 drug combos.
Section 3. The prescribing cascade.
Because doctors obviously can't track all these overlapping interactions in their heads, patients often fall victim to one of the most consequential patterns in modern healthcare. It's called the prescribing cascade. This is a terrifying loop where the side effect of one medication is totally misidentified as a brand new disease. And, well, how do we treat diseases? With more medication, right? Here's a classic example straight out of the medical literature. Step 1. A patient takes a calcium channel blocker for high blood pressure. Step 2. It causes ankle swelling as a side effect. Now, instead of just swapping out that first pill, the doctor thinks, oh, this is a new condition. So step 3, they prescribe a diuretic for the swelling. Step 4, that diuretic raises uric acid, which triggers a painful case of gout.
So step 5, the patient is handed an NSAID painkiller for the gout. And finally, step 6, the NSAID actually raises the patient's blood pressure, completely undermining the very first drug they ever took. Treating simple blood pressure just spiraled into a 5-medication disaster.
Let's move to and see how this builds in another scenario, because this absurd spiral happens every single day. Take statins. A patient starts a statin for cholesterol. Next, they get muscle pain as a side effect. So they take an NSAID for the pain, but the NSAID burns their stomach, causing GI irritation. Naturally, a doctor then prescribes a proton pump inhibitor, like omeprazole, to soothe the stomach. But here's the kicker. Long-term use of that acid reducer blocks magnesium absorption, so their magnesium drops, and suddenly the patient is suffering from severe muscle cramps, literally worsening the exact symptom that started this whole pharmaceutical mess.
Section 4. The Beers Criteria Explained.
Now, what's really interesting about this slide is how we actually stop this madness. How do we even know which drugs are the main culprits? Well, we look to a wildly underpublicized document called the Beers Criteria. This is published and regularly updated by the American Geriatric Society, and it's basically an essential master list of medications that are considered potentially inappropriate and highly dangerous for adults over 65. For older adults, the risks of these drugs simply outweigh the benefits. Yet, unbelievably, a lot of primary care physicians aren't even familiar with it. The Beers Criteria tracks these high-risk meds, and it's honestly shocking how common the offenders are. Take benzodiazepines, drugs like Valium, diazepam, or alprazolam, usually given for anxiety and sleep. In seniors, they dramatically spike the risk of falls, hip fractures, and even dementia. Then we have NSAIDs like ibuprofen or naproxen, widely accepted, right? But in older adults, they carry outsized risks for severe GI bleeding and kidney damage. And sulfonylureas, these are diabetes meds that stimulate insulin. They carry massive risks for sudden, life-threatening drops in blood sugar, simply because older adults lose the neurological ability to feel when their blood sugar is crashing.
But perhaps the absolute sneakiest danger on the Beers Criteria is something called the hidden anticholinergic burden. These are drugs that block acetylcholine, which is a crucial neurotransmitter in your brain. You might think, oh, I'm just taking an innocent over-the-counter sleep aid or popping some Benadryl for seasonal allergies. But those contain diphenhydramine, which is a strong anticholinergic. We also find them in some antidepressants and bladder medications. When you stack these up in your daily routine, the cumulative burden causes severe confusion, memory impairment, and is directly linked to an increased risk of cognitive decline and dementia. I can't stress this enough. Over-the-counter does not mean risk-free.
Section 5. How to take control.
I know. All of this sounds really alarming. The thought that the very pills meant to heal us could be causing memory loss or dangerous falls, it's deeply unsettling. But here's the good news. We're going to pivot right now from the problem to the solution, because you can proactively fix this. Being an empowered consumer is honestly the most essential act of self-care. The first step to taking control is understanding a concept called de-prescribing. This is the careful, medically supervised reduction or elimination of medications that are just no longer providing a net benefit to you. We have to completely reframe how we think about this. Dropping a medication isn't a loss of medical care. In fact, multiple clinical trials show that targeted de-prescribing actually improves your cognitive function, lowers your fall rates, and boosts your overall quality of life, all without worsening your original conditions.
So, the crucial point is putting together your concrete medication action plan. First, ask your doctor or pharmacist for a brown bag review. Literally grab a bag, throw every single prescription, vitamin, and herbal supplement you take into it, and have them systematically review the whole pile together. Second, explicitly ask your doctor, hey, are any of my medications on the Beers Criteria? Third, anytime you get a new symptom, ask if it could actually be a side effect before you let them hand you a new prescription pad. Fourth, make sure your kidney function is being tested at least annually so they can adjust your doses appropriately. And finally, maintain a master list of absolutely everything you take, so if you ever end up in the ER, the doctor there has the full, accurate picture.
At the end of the day, you hold the power to stop the prescribing cascade before it even starts. Knowing exactly what you're taking and why you're taking it could protect your brain, save your kidneys, and frankly, preserve your independence. So I want to leave you with this one question to really think about today. When was your last comprehensive medication review? If you can't remember, or if it's literally never happened, it is time to make that appointment. Thanks for joining me on this explainer, and stay safe out there.